Um, Welcome, everyone. I want to note that we are recording this session, so I just thought I'd give you the heads up. Welcome to the second session of our four-part webinar series on the CSA Z1011.1, and it's from calendar year 2022. This is the standard on work disability management in the Paramedic Service Organization. I'm Emil Tompa, and I'm one of your co-hosts for today. This session is being hosted by the Center for Research on Work Disability Policy, or CRWDP, which is currently actually transitioning into the Inclusive Design for Employment Access, or IDEA initiative, which is a social innovation laboratory focused on employer capacity building in the area of inclusive employment. And I'm the executive director of IDEA. IDEA has been recently funded by the New Frontiers in Transformation Stream for a period of 6 years. I want to start off with a land acknowledgement so that we all are aware of the lands that we are seated in. Where I'm currently situated has for thousands of years been the traditional land of the Huron-Wendat, the Seneca, and most recently the Mississaugas of the Credit River. Today, this land is still home to many Indigenous peoples from across Turtle Island, and we are grateful to have the opportunity to conduct our work on it. Please note that this is the land acknowledgement that is relevant for Toronto. However, since we are gathering for this meeting virtually, we would also suggest knowing the communities in your respective locations as well and thinking about them at this time. I just want to acknowledge the key source of funding for the development of this standard, which came from the Defence Research and Development Canada Centre for Security Science, though the views expressed here and in the standard do not necessarily reflect those of the funder. Next slide, please. This is our outline for today's session. There are multiple speakers who will comment and present an overview of the standard development process. Our key highlight actually is for this session is an excellent stakeholder panel who are also part of the technical committee that developed the standard. We have some questions that they will be speaking to on different stakeholder roles. And at the end, we will also open it up to the audience for questions and answers from the audience. So please do feel free to ask questions of the panel. There's a questions and answer tab at the bottom of your screen that you can use to submit your questions, or also you can ask questions through the chat function. So please do take advantage of the opportunity to participate in the panel session at the end of the formal part of the presentation. Next slide, please. The webinar series is being co-hosted by CRWDP, as I mentioned now, the IDEA Social Innovation Laboratory, and the Canadian Institute for Safety, Wellness, and Performance. I, along with Amin Yazdani, are your co-hosts for these 4 sessions. Next slide. So now I'm going to pass it on to Pierre Poirier, who is the Chief of Ottawa Paramedic Services and was also the Vice Chair of the Technical Committee that developed the standard. So take it away, Pierre.
Thanks, Emil, and welcome to everyone. Pleasure to be here today. You know, sometimes when I talk with Amin and we look at different standards, he asked me to kind of put this back in context, and it's always a pleasure to provide context to today's discussion. And I'll be brief just on the front end. Probably at least 10 years ago, there was a standard that was developed by CSA Group called Psychological Health and Safety in the Workplace. And a few years later, the paramedic community actually got engaged through funding through the Ministry of Labour in Ontario. And we were able to get a standard specific to paramedics, so psychological health and safety in the Paramedic Service Organization. And those are seminal documents, they're foundational. And in the last couple of years, there's been a number of standards that have been kind of built off of those. Of note is the fatigue risk management, which is still ongoing. And this standard, work disability, which are kind of complementary to these baseline standards. And I think that really is an important piece for the paramedic community to kind of see the linkages between them. Because when we talk about work disability, it does relate back to psychological health and safety. So the challenge has been for all of us is how do we make sure that the linkages are appropriate. And really the CSA has been an excellent partner for the paramedic community to ensure that that is so. And compliments to everyone who's been working on this standard as it comes to fruition. and look forward to further discussion today. So that was kind of just the front end work here. I think it's a wonderful day for the paramedic community to start to see the continual development of standards. And we often reference the international model that firefighters use, where they have what is called the National Fire Protection Association, which is a standards development agency in the States. But Canadian firefighters absolutely do participate in that process as well. And those standards over time sometimes become written or are written into legislation. And the paramedic journey here is not dissimilar from that. We have a great relationship with the CSA Group. And bit by bit, as we develop these standards, hopefully that portions of them will become part of legislation to continue to support the first responders, the paramedics who provide service to our community. So that's an introductory element from myself. Thanks for that, Emil.
And we'll pass it on to Alina. Alina, please.
Hi there. Good afternoon or good day to everyone that's joining. So I'm going to be speaking about the standards development and how the standard actually came to fruition. So next slide. Thank you. So what I'll be covering just a little bit about who CSA is, how the members got to that final publication piece, an overview of the standards, and how they can be applied. So next slide. So just to kind of to lay the context about CSA, CSA has two areas. So it's a CSA group, and there's two areas. It's a global organization, non-governmental. We have a commercial arm, as well as the standards development organization, which is non-for-profit. Next. And then within that standard development organization, there's three areas that we work with. So with the development of the standards, also research that goes towards standards, and also an education arm. There's some training program and workshops that CSA works with third parties and experts in the area to develop programming for that. Next slide. To what was mentioned earlier, so with the standards development organization, I'm the project manager. I lead and facilitate the technical committee members, but it really are the members that are around the table, and right now they're virtual tables that develop the standard that has come to light. Next slide. What I'm sharing here on the screen is the cycle that all committees go through to get to that point. Just go hit next slide. So here I'm highlighting within that cycle, you can just press next slide. So in that cycle, this is what the committees go through, all members, from initiating the committee to the full piece of disseminating the standard. On the screen, there should be two arrows, and that's the public review, and also when it gets disseminated, just highlighting that area, because even though an individual may not be part of the process of that committee, the public, the external stakeholders, you're able to provide input at those two stages. So once the standard goes through, is at the draft stage, it goes out to public consultation through our public review site. And that's where any member from the public can read over that draft document, provide input, and then the committee looks at it once again to really determine if that consideration should be added or how what's already in the standard can be refined. And as well at the very end, when the standard is published, of course, that is intended for external stakeholders, but we're also welcome to hear any requests for clarifications and to hear from the public on how that process can be continuously developed. Next slide. So here on the list are a couple of standards. One that's highlighted on my screen is the one that we're speaking to, the work disability management in the Paramedic Service Organization. There's one a couple of rows down, the one up here I had mentioned about first responder fatigue risk management, and see it all alongside the publication year. So that's fingers crossed, expected to publish later on this summer in August. Next slide. So here's a continuation of standards that are intended for the paramedic community. These are all on our the CSA store, but if you're interested as well to find out a little bit more, you can always reach out to me and I can direct you to that project manager of each standard. Next slide. So in going back to the committee and what that looks like, so CSA works towards achieving a balance of representation from different areas to input and to feed into the standard. This particular standard had, let me look at it, 5 different interest groups that came together over a period of time. We're almost looking at a year to work through each clause. So how it was developed and put together, it was through the membership that is highlighted here on the screen. So next. So a lot of times CSA often gets the question, well, once a standard is published, is it mandatory for an organization? And this goes back to what Pierre was just mentioning, that this particular standard is a voluntary standard, but what we're looking to achieve, because it was done with the experts in the area, is to hopefully later on it will get referenced in legislation, and then it becomes a mandatory piece of legislation that needs to be adhered to. And often the government will come to CSA because of the experts that were around the table to look at that standard and looking at adopting it. Next slide. So ways to get involved. So anyone that's here listening to and perhaps watching as well, that you're welcome to join a technical committee, even though it's already published. There's continuous work that's being done. So feel free to reach out to me. And there's numerous other standards as well. So you're welcome to participate on a CSA committee, as well as a reminder that all external members are welcome to participate during the drafting at the point of public review. And as well as there's any, you can always follow along on the CSA communities to find out new developments and new committees that are being put together. Next, and that's everything for me. And I'll hand it over to the next presenter.
Okay, which is me. Thanks, Leah. That was great. Okay, so where are we at? Next slide, yeah, that's good. Okay, so we'll start here. So in the next 3 slides, I'm going to give you a brief overview of management systems, because this standard, along with many of the CSA standards on organizational best practice, take a systems level approach to addressing change at the organizational level. And the traditional approach that we've seen taken to address disability issues in many organizations has been very reactive, addressing health needs just as they arise, so putting out fires as they need to address certain issues. And that's the whole reason why we developed these best practice guides to help organizations take a more proactive systems level approach. Additionally, what we've seen is that the responsibility is often assigned to a single person or department, you know, a disability manager or disability management department within, sometimes within HR or maybe a standalone disability management organization, but or standard disability management department that rarely has it been taken as a systems level approach. So we really try to emphasize that broad brush organizational systems level approach. In fact, some organizations actually farm out the disability management function to external service agencies, so they don't really do it in-house. Whereas the systems approach is really meant to be proactive and consider all the roles and responsibilities across the organization. Everyone plays a role within the organization, and defining those roles and being familiar with that structure is really important for an organization to function well in the area of disability management. The systems approach is meant to be proactive, you know, and considers inputs, process, outputs, and feedback with a real critical emphasis on evaluation and improvement on a continual basis. So next slide, please. So I've been asked this question a lot: what is a management system? So I put this in many of my presentations when I'm talking about CSA standards that are designed around management systems. So it's not a commonly known term outside of management studies, but it's a formalized framework of policies, processes, and procedures used to meet an organizational objectives. And it's documented, tested, and step-by-step methods that are really aimed at smooth functioning. And audits are a critical part of the management systems approach, because ideally, they're looking at these issues on a continual basis. And an organization should have these kinds of management systems framework for all core areas of their activities, including work disability management. So the systems approach to work disability management really ensures that there's clarity, consistency, and integration with all of the other organizational activities. That proactive approach to work disability management really tries to address health needs of workers before they become disabling. Next slide, please. So this is a schema of how the management system approach works at the organizational level with continual improvement at its core. Do you want to just click next? It starts off with policies, which play a really fundamental role in setting a very clear direction for organizations to follow. Press again, thank you. The management structure also needs to be in place to deliver on those policies. Press next, okay. And then it requires a planned and systemic approach to implementing these policies. Next. And it really emphasizes measurement of performance against targets to identify areas that still need improvement. And next. And then finally, review and learning from these experiences are fundamental to that continual improvement process. Next slide. So I'm going to pass it over to Min, who'll give you an overview of the specifics of this standard. Take it away, Min.
Okay, thank you, Emil. Next slide, please. Well, the standard, as Emil presented, focuses on the whole process of management system structure and how different elements of the system can work together to help organizations, paramedic service organizations in this case, succeed in implementing an organizational-wide program to address work disability. This standard has some focus on operational stress injuries, but it doesn't mean that it cannot be applied for other type of disabilities. Indeed, the standard has a general framework that could help organizations address work disability management system, work disability within the organization, regardless of the type of disabilities. We have provided several recommendations and guidance around operational stress injuries that could be quite useful. The elements of this standard are summarized in this slide. As you see, we have some information on the scope and making sure that we have clear definitions of some of the key terms used within this standard. The body of this standard is where you can find most of the information and requirements. And we have also included some annexes, which are informative, will help further with the organizations into implementing this standard. Next, please. As again, Emil suggested, that system approach uses that famous PDCA model. The PDCA model has been used for many, many years into different disciplines. And I think what we tried to do, we tried to stick with that PDCA model for many, many reasons. One was to ensure that the different standards within CSA could be implemented together or into an integrative approach. And most importantly, because we want to allow the integration between several internal systems, and also creates a platform that allows stakeholders to speak the same language. If you're actually implementing PDCA for any performance, productivity, or quality type of goal, that same approach, that same PDCA, that same terminology, same language could be applied towards disability management as well. Next slide, please. In terms of the scope of the standard, we've kind of really focused on developing some requirements that can be used in the paramedic service organizations to address the health needs of the workers in order to prevent or manage work disability. We've kind of specified requirements and guidance related to management of work disabilities associated with operational stress injuries, but as I said, they are kind of other health conditions that could be again managed through this standard as well. It so happens that we have additional focus on OSIs given their significant impacts on our workforce. Next, please. So the standard sets requirements and guidance on the roles and responsibilities of key stakeholders, systematic process in which organizations really build capacity to address any workforce and workplace challenges cannot be a one-person job or a silo program within an organization. as research suggests in this area, any sidecar function within organization that only focuses on one aspect of outcome will not be successful, and fails. And if it's not connected to a broader management framework, it makes it very unlikely for organization to sustainably implement that program. So one of the important aspects of what we did here with the roles and responsibilities was around identifying roles and responsibilities for key stakeholders. So in this standard, through extensive consultation, we've listed 5 key stakeholders, including top management, frontline managers, and supervisors. That could be chiefs and deputy chiefs and other supervisory level kind of jobs within the PSOs. Internal subject matter expertise, or experts, disability management specialists that may be in-house or may be external to the organization, healthcare professionals, workers and their representatives or unions in the paramedic community. So we provided detailed guidance on their roles and responsibilities in the PDCA model. And this guarantees that the internal and external stakeholders are fully aware of the roles, and it also creates the starting point for organizations to plan and execute execute their goals within the full involvement and with full involvement of key stakeholders and decision makers. Next, please. To take a deeper dive into this standard, we have summarized the key requirements of this standard within this kind of 3 main clauses. Going to the known PDCA model, we're focusing on a dynamic process in which learning from our outcome is continuous. And that's exactly what the focus is, right? So we want to make sure that organizations, paramedic service organizations, are continuously improving their practices. As is outlined in the standard, you always start with the planning. So you don't want to reinvent the wheel. You want to start with reviewing what you already have in place and get the stakeholders to identify gaps, and consequently, then you set objectives and targets. This is an important step towards the success of your implementation. You need to know what to focus on, where to find evidence, and how to plan for success. And this standard, for the most part, actually provides some guidance and help you through the process to ensure that your system works and ensures that you have commitment to continually improving your work disability management system. So after you set your objectives and targets, you go to an implementation phase. You would implement your objectives and targets based on the timelines that you identified. You go and identify barriers and challenges and facilitators for the implementation, because that's going to help you to document lessons learned, identify where you are going to have problems in future, and then again try to measure your progress and the impact using objective and subjective measures. You need to keep in mind that having baseline data is the key to measure your success and failure, and without that, you're not going to be able to demonstrate that return on investment. So an important note here is that any objective and targets you set must be appropriate to the nature and capacity of the paramedic service organization. So you should not be really identifying some objectives and targets that are practically impossible or very costly for organization to do in the short term. So it's very important to note that the work disability management system is a continuous, ongoing kind of a process in which you may have short-term and long-term and mid-term kind of objectives, and you got to be patient, making sure that you add those objectives and targets as you mature your organization when it comes to work disability. While and upon the meeting of your objectives and targets, you need to start looking at, well, what kind of things I can do to improve my progress and work towards additional objectives and targets to take you to that level of excellence that your organization may set to thrive. So monitoring your organization performance then becomes important. becomes key, and it could help you to re-strategize for future improvements. And without these performance monitoring, you're not going to be developing effective strategies for long-term sustainability of the program. Next, please. Last but not least, the standard has several informative annexes. So these are additional information to help with understanding. So there's no requirements, they're just guidance material. And what we did with the standard, we have a lot of resources and evidence-informed practices. Are they state of the art? I would say for the most part, yes, but there is always room for improvement. And as new evidence kind of emerges, what we did here, we tried to include resources that are perceived to be practical by paramedic service organizations. But again, as I said, as new evidence emerges, these material needs to be updated. Hence, there might be some good practices out there that, again, we may not have included, but what we believe and we acknowledge that the current resources are very useful to get paramedic service organizations to start their journey to a more inclusive and disability management friendly kind of organizations. And the annexes that we have here, including wellness checks during a medical leave, mental health, literacy, training, education, worker focused kind of exposure programs and stuff like that, and additional resources are going to be very, very useful to support the implementation of this standard. So kind of that's what all I had. If you would like to learn more or interested to implement this standard, researchers at CSWDP and CRWDP, I think we'll be delighted to support you in the work that you do. And we hope that partnership and engagements would kind of help provide a mean to address work disability and prevention of operational stress injuries among paramedics. Thank you.
I'm going to move into the panel session. I can see my camera is back on. Next slide. So I'm Lena, and then we'll move into the panelists, and just to quickly introduce the individuals that will be presenting. We have Pierre Poirier, we have Dr. Kati Kamkar and Robert Parkinson, as well as Denise, and I'm practicing your last name here for a little while, Annie Kiariko. So please correct me if I have that wrong with the pronunciation. So we'll move
That's
to
okay,
the next. Thank you. Next slide. So there's a couple of questions, and then Emil, if you're on the line as well, I can go through them. I'm just going to start with the first one for you, Pierre, and it's out here on the screen for anyone who can see it. So how can the new CSA Z1011.1 help organizations better manage work disability related to occupational stress injury? Start with that.
Yeah, and first off, as I mentioned in my preface, is the key part is the linkages to the psychological health and safety in the Paramedic Service Organization in that document. I think this document absolutely builds upon that initial document and provides further information and guidance specific to what would be a subset of the broader context of psychological health. But at the same time, incorporating the physical component as well. So I think this is an area that really did need a little bit more information. And this document, I think, provides that structure to assist organizations and help them. And because that's oftentimes in the leadership roles, is that you're looking for the reference point or references that are legitimate and can provide good information on how to do or what to do. And I think the way the document is also kind of prepared and structured is valuable to a leadership of the organization.
Thank you. And then to everyone listening as well, the document itself is available for complimentary download. So for any organization and any individual to have a copy of that. And moving into the second question here, how can top management ensure that the successful implementation of a systematic approach to work disability? So they have the standard in their head. How can they move? How would you recommend moving them into that next piece?
Yeah, I think the value of this document and several other CSA standards, and my apologies for plugging them, truly is that it provides a systems approach to how you can address the situation. We often hear a lot of talk about stay at work programs or return to work programs, but really it's kind of how do you get there? What are the mechanisms or procedures or policies that you have to put in place to get there? And that's where I think the quality of the document resides on what is required to be done. And then with the annexes, which provide further information, which are informative and really do help ensure that you can have a successful implementation.
And then on that, just continuing with the third question here, and then we'll move through with the other panelists as well. Can you speak to the importance of the management commitment and leadership? So,
yeah, thanks for that, Lena. And this is kind of the toughest part of this is, and I shouldn't say it in terms of having that commitment, but it's actually getting past the inertia and doing what is right and doing what is appropriate in this space. What I really like in the document is that it lays out what top management, the expectation is for top management. And the but here is that it's inclusive of everyone within the organization, including the individual. And I think that's a key element within the document, that the onus, or there's a positive onus on everyone within the organization to make this work. So right up to and including the individual for whom we provide this service. So I'm really kind of encouraged by kind of how the document is structured, and that the success of the document will absolutely reside with a positive leadership. Much like when we talk about stigma and how important it is to eliminate stigma, this is an area where I think the leadership from top management is crucial to the success of work disability management. And overall, this is and I can speak for here in Ottawa, it's a significant problem, both from the physical and the mental. When you have staff away, how to bring them back safely, how to be sensitive and encouraging while people are away, and how to have somebody return to work whole, and all of the steps that are required to support that. So I think this is really an important document. Thank you, Lena.
Thank you, Pierre. And just a reminder to everyone that is here participating, you're welcome to send in your questions in the Zoom format at the bottom of your screen. Typically, at the bottom of your screen, you'll find a Q&A. So feel free to ask your questions. And once I do see them, I can look to see if it's addressed to one individual or to the entire panel of speakers. I'm going to move into next slide, please. So next we have Dr. Kathy Kamkar, and Kathy is a committee member on the standard, as well as she was representing the service provider. So Kathy, I'm going to ask you a couple of questions. Just want to make sure that you're able to hear me.
Absolutely, thank you.
You're welcome. So I'm just sharing the questions on the screen here to the participants. And the first question is, from your perspective, how can the new standard help organizations better manage work disability related to occupational stress injury?
Yes, and I think that my answer might also encompass actually those three great questions. First of all, I'm very honored to be part of this panel. Thank you so much for having me. And as also everyone has expressed, it's actually very exciting that finally we have this guideline and this standard. We really need to know where we have come from. Up to now, most recent years, all our guidelines are really around musculoskeletal injuries. And these are brand new in terms of mental health and mental health disabilities, and having a better understanding that yes, mental health disability is multifactorial, and it's demanding an interaction between the person, the individual, and the environment. And the standard is very comprehensive and thus provide a lot of respect in that regard, that entire holistic approach to care, whole person management approach, and this very much evidence-based comprehensive approach when we talk about mental health disability. Now, also, we know through, there was a great systematic review that really, even prior to the standard, that looked at whatever that was available, which, as we know, was very few and not very well organized. But that systematic review provided key recommendations that, yes, we do need to have well-described organizational policies and procedures for the roles and responsibilities for all stakeholders. We need to have well-informed work accommodation. We need to have disability management, and of course, mental health literacy for everyone, but especially for the supervisors and so on. So it is, again, this standard really takes into account all the evidence-based research and the findings and everything, which is so important. The other issue here is as to, again, the importance of it and the role of the internal disability management and everything. And again, only talking about OSI, is that we do know that, again, mental health disabilities on the rise, that mental health disabilities, the costs related to mental health disabilities are higher than the costs related of physical health disabilities for mainly two reasons. More likely to reoccur, so 7 times more likely to reoccur, and then also because of the longer duration. There is also comorbidities among mental health conditions, and also comorbidities among mental health and physical health conditions. The other aspect is that mental health disabilities increase the risk for a recurrent mental health disability, but it also increase the risk for non-mental health disability. So, for example, accidents, injuries, and so on. The other here positive thing as to why this is, again, it's a great that, again, the standard really addresses head-on mental health disability is, again, in link with the newer systematic reviews, actually from Lancet Psychiatry, that found that, yes, when we do provide evidence-based interventions, and especially when you have access to disability management services, it does help to reduce the chance for disability, and it helps to optimize return to work. And again, this is also consistent with prior findings as well. Obviously, we need to engage in more research, but we do know having access to evidence-based treatment and disability management during absence from work and then after the leave, it does help to reduce the recurrent disability leave.
Thank you. And that really covered number 2. So I'm going to move into the last question here, which is how can healthcare professionals like yourself best work with paramedic service organizations to support them in their management of occupational stress injury?
That is so important, right? Especially when we look at prevention continuum of care. It's a continuum, right? So you have primary prevention, secondary prevention, and tertiary prevention of care. And it's continuous. So the positive news is that from tertiary, we can go to primary. So primary is anything that we do prior to an onset of an illness. Secondary, and they're all complementary. Secondary is there is an onset, either there is a problem we need to address head on, or we are suffering from any symptoms, mild to moderate, that we need to address. Sometimes it could be as peer support or healthcare professionals, maybe again, any work changes, work accommodations, anything that might be needed. And tertiary prevention, this is when the symptoms can range from moderate to severe. And yes, this is when we really need more so any work accommodations needed, collaborative care model, disability management, and focusing on the person's functioning and helping towards any return to work, because again, it's not only absenteeism, but it's also presenteeism that we need to take care of. So and we know through research, any collaborative care model, so Healthcare professionals, obviously, we want to make sure that our healthcare professionals are fully informed and trained in terms of paramedics and the culture, trauma-based informed care, evidence-based trauma, focused care. So we want to make sure that there always the right training and the knowledge and everything. But the more we are able to have this collaborative care model in terms of the employers, and of course, a lot of times we see benefits and insurance, and with the healthcare professionals, we have actually seen we are able to reduce disability, or even moving from short-term to long-term disability, even addressing it head-on. So sometimes a person might, again, still be working full-time, but often we notice signs of presenteeism. So here presenteeism is I'm fully present, but I'm not achieving my full functioning, my full potential. Performance, productivity, everything could be down. It could be, again, depression, anxiety, or any other problems or struggles that I might be going through. And people might start seeing a healthcare professional right there. So anytime at that point that the person, along with the healthcare professionals and the organizations, might say, you know, if I'm able to make any changes, any little tweak within my work, I think that that might really make me much optimize my treatment care, but then also me staying at work and my productivity and performance and engagement. And again, we have a lot of chance for focusing on reducing any and taking care of the mental health in general, but in the disability management aspect.
Thank you so much, Dr. Kamkar. I'm going to go to the next panelist. The next is Robert. So Bob, you're welcome to turn on your screen. And if not, definitely you just let me know that you can hear me, and then we'll start going through the questions.
I can hear you, Lena.
Okay, great. Thank you. I'm going to ask you very similar questions, but from your perspective, how can the new CSA standard help organizations better manage work disability related specifically to occupational stress injury?
Oh, thank you for having me here. Yeah, I think a lot of people have talked about this, and I think that we have to understand that we can no longer look at injury, or especially occupational stress injury, as we've looked at physical injury. Previously, we looked at it as a medical model where 6 to 8 weeks, you're off for a sprain, strain, go away, come back. Operational stress injuries are far more complex. And as everyone has stated, it relies on the entire part of the organization participating in various ways. So I think the new standard takes that biopsychosocial approach, looking at the individual and the factors that play into that injury or that return to work process, and then bringing the various stakeholders into the organization, into the process. And I think the guidelines help establish that and help build a framework for us to do that. I think by doing that, we can improve recovery, return to work outcomes. And I also think that we increase employee wellness. The more we're active in injured workers' lives and supports and systems that we can help them with, the better the organization is, the more that the workers and the employees feel valued and cared about. And I think that helps everybody from a mental health perspective and an operational perspective.
And that leads us into the second questions, looking at managers and supervisors. So how can they support workers in the prevention and management of occupational stress injury in the context of the standard?
Yeah, so I think one of the key things that was stated earlier for me is still that stigma is a barrier. It's not easy for everybody to come forward. And part of the standard in putting in a health standard or disability standard like this, it allows us as an organization to create an environment where, you know, being proactive, coming forward early, identifying for yourself, or being proactive and putting your hand up and getting assistance. So I think that managers and supervisors need to understand what's available, what their roles are as laid out in the standard that we've tried to do that. Provide assistance, be active in the process. And that's awkward for a lot of people because, you know, when I step into an injury process like operational stress or occupational stress, then what am I opening a door to? And I think that's where organizations and this new disability standard can assist you in developing those systems, being proactive and ready for what comes, understanding that there is a privacy component. It's important for all our employees and our workers to understand that we're going to maintain those privacy parameters and then protect them. And then we're going to assist them the best way we can. And it's okay not to have all the answers. Even if we don't have all the answers, we should know where to go. And then we should be active in that response system. So if we ask somebody for, can we help you? Or if they need help, that we get back to them in a timely manner and that we don't leave them hanging just because we haven't got a good answer for something. So I think the standard really brings together a framework and a foundation for us to develop those systems of support.
And that system of support that you're speaking to really looks into the second question of creating that very safe space and inclusive environment, and looking at it for managers and supervisors. What can they do in that space of being inclusive, safe, and supportive?
Well, the standard lays out the system, and I think they do it in a very good way. And I think what's really important is for us to also remember that we need to maintain empathy. We need to maintain that concept of understanding of that biopsychosocial system, that everybody's journey and everybody's injuries can be different. We're going to have varying factors that play on our negative influences and our positive influences. And it's really important for us to create a psychologically safe environment where we can share those, where we can go for those supports and deal with those. We need to make that connection. Just because we're afraid to step into this environment, an organization can develop a system where you don't have to be so fearful as a manager or a supervisor, and that you can make that connection. And we can't forget that, the employees of a paramedic service organization have a high value in the work that they do. And anytime there's a separation from that work or a separation from that environment, that's impactful. And if we just leave them out there, that's even more impactful because they feel less valued. They feel that the work that they do doesn't have meaning anymore, and that impacts their self-identity. So I think it's really important for an organization to implement a system like this and use this foundation to develop those resource supports. And the managers and supervisors play a really key role in keeping those people engaged. They can have return to work programs, stay at work programs developed, so that we maintain that environment where that employees are really needing to maintain their self-esteem. And it helps with recovery. It helps with the return to work processes, and it helps with prevention opportunities in the overall system.
Thank you so much, Bob. We're going to move into the next panelist. And thank you, Denise. And while we go through the questions, just a reminder to everyone that's participating, you're welcome to submit any questions that you have. Now, Denise also represents the organizational perspective. So I'm going to ask you very similar questions, and I know your position, a different insight as well. So with question number one, how can the new standard better manage work disability related to occupational stress injury?
So I think, as Emil noted previously, the application of disability management looks different across organizations in Canada. In some cases, there are disability management teams that work collaboratively with staff, leaders, third-party insurers, and in other organizations, there might be one individual in HR assigned to DM, or possibly no focused DM role at all, which can leave people leaders to manage absences due to illness and injury on their own. So I think that the standard helps organizations to apply best practices in a consistent and effective way, with the goal being overall health and well-being of paramedics. I might add that the standard document acts as a resource for organizations in that it offers helpful guidance, such as return to work processes and accommodation practices, as well as programs and resources such as peer support, which can help to advance their current practices.
Thank you. Going to question number two, what can work representatives do to support worker health needs?
So certainly I think that union representatives play an important role in the guidance and the support of their members in a general perspective, but also on a case-by-case basis. I think if we interpret worker representatives to include formal reps, such as those, but also more informal advocates, such as peer support team members, health and safety committee members, health and wellness committee members. It's important that worker representatives assist organizations with promoting awareness of the programs and resources that are available to support worker health needs. And that could include any changes or updates that were made to those programs, reminders about how to access. I think it's important to note that any programs or resources offered by an employer, be that benefit programs, EAPs, training in mental health, literacy, resilience, those should be evaluated on a regular basis to ensure that they're still effective. And often employers consider trending data when they're looking at creating new programs or making changes to programs. Some trends are easier to gather, such as illness data and those kinds of things, but others require a very collaborative relationship with workers to really hear what their challenges and concerns are and implement those when making changes to programs. So I think that worker representatives are essentially the eyes and ears of the organization, and they bring valuable information about what's going on, or sorry, what is going well, and maybe what requires some change.
Thank you. And the standard notes that worker participation is essential. What do you see as the key role for workers in the prevention and management of occupational stress injury?
So in terms of prevention, I think it's important that they maintain an awareness of resources and supports available. And that's from the time of hire through to and into retirement. So I think that when we hear that information once, but we don't need it, we often forget. And it's really difficult to start to look for information on resources and programs available when someone is struggling. So to try to do that on an ongoing and consistent basis is ideal. I think that if an employer invites feedback from staff about programs and resources, so an example would be surveys, and I know these can be tedious to complete, but to take the time to participate. If feedback isn't requested, maybe take the time to provide it anyways, whether that be informally through union representatives or leaders or HR representatives. I think another important thing to consider is to have a family physician or a GP. Medical absences from work, including WCB and long-term disability claims, those typically require supporting documentation from primary healthcare providers. It's best to have that in place before we're in a place where we're trying to struggle to get that in place for a worker. Selecting a mental health provider before you need one. So taking the time to build a rapport and maintain your mental health and well-being. Mental health providers that apply an evidence-based approach and who are experienced in working with public safety personnel, such as paramedics, can be really challenging to find. And so to take some time in that first session or two to see if they're a right fit for you and your needs. And again, starting that process when you're well versus when you're struggling is beneficial.
Thank you very much, Denise, and as well, thank you to all the panelists. I'm going to open up now to Q&A session. There has been one question that's been submitted to all panelists. So just a reminder to unmute your mic, and I'll read out the question here. The question reads, what key services would you suggest to be in place to support workers with the early onset of OSI, so occupational stress injury? I'm happy to read that over. So any of the panelists can start. Question is, what key services would you suggest to be in place to support workers with early onset of OSI?
So I'll start and invite the other panelists to add to my answer. I think it's really important to provide a number of options or doors, if you'd like to consider it that way, for staff to walk through. Certainly a strong disability management program would be key. Other options would include peer support teams trained in CISM practices with a clinical director that staff can access and potentially get to disability management if that would be required. An EAP certainly provides some opportunities for access, not necessarily with ongoing management of an OSI in working with WCB and so on, but could address some other prevention type needs that staff would require. So I think my key point would be to provide an array of services that staff can choose where they're most comfortable starting that road, starting to reach out. And then the last thing I'll add is education on how to select a mental health provider. So I mentioned that it can be challenging to find someone that is skilled and experienced in working with this population. And I think that finding the right provider is essential to ongoing well-being and recovery if needed.
Thank you. I see, Bob, that you've unmuted and turned your camera on, so I'll hand it over to you, and then we'll move into Kathy.
Okay, Lena, yeah, thanks. And I'll just add to what Denise had to say. I think it's really important to, you got your clinician base, and that's sort of the first thing we run to with our thought process. I think organizations have to have a strong stay at work program. a modified duty opportunity, a system where people can stay engaged. And that requires some planning from organizations, and it requires some opportunities for those modified duties, so that when I identify that something's starting to affect me negatively, I can put my hand up. I have a system in place where I know I can go to and maybe change the duty that I'm doing. Maybe there's another work that I can still do that's effective and productive and keeps me engaged and feeling well at work. And then I think peer support systems are also another alternative you should have set up for people to talk to others before the injury is too late. Having a good peer support system in place can assist with that.
Thank you very much, Bob. I'll move it over to Kathy, Dr. Kamkar.
Thank you so much. And I agree with everyone. And just very quickly, briefly adding again, I always like to remember the prevention continuum of care. So to make sure that we always have a comprehensive approach at both the individual worker level and also at the organizational level. Definitely in terms of, again, we want to focus on the data and the evidence-based findings. So we do know that providing any support, any mental health resources can go a long way. Definitely peer support as well. And ensuring, again, we are working continuously on reducing stigma, and especially workplace stigma, because stigma really contributes to disability costs. So peer support, having access to resources, someone to follow up, and anything that might be needed, again, in terms of workplace. Sometimes it could be a little tweak in terms of what time a person might maybe start the work, or sometimes the person might just for some time might not be able to do frontline and might really benefit from meaningful modified work. For everyone, again, it's very different. And that is why we always say that workplace accommodation is very individualized, and it focuses on the person's needs, what are the person's abilities, any restrictions, and of course, overall level of functioning. But it's very much individualized. So if whenever, again, a person is also being supported on being able to express what the needs are, then we know that ensuring that it is provided to, again, helping reducing any presenteeism and ultimately disability and absenteeism.
Thank you very much. And thank you to all the panelists. We just looking at the time. So I'm going to hand it over to Emil.
Great. Thank you, Lena and panelists. So I'm just going to close the session. We're already at 12:59, so we only have a minute to go. So I just want to mention, what slide are we actually on now? The resources. So we have the CSA Z1011.1 available at the CSA website. Link that's provided on this slide, where you have view access. And I believe, Lena, you said you can actually download it as well. Is that correct?
That's correct, yes.
Okay, super. So you can even download it. Okay, we have 2 more webinars coming up in September and October. So some more detailed looks into the ways you can implement this standard in your organization. So webinar 3, which is on September 19th at noontime, we'll be talking about managing disabilities associated with operational stress injuries. And then webinar 4 on Monday, October 17th at 12 noon Eastern time. How does the standard address the needs for paramedics with injuries and disabilities? So lots more details to be discussed through the forums of these webinars. And then we're also developing a communities of practice page, which is in development currently. Next slide, please. Okay, so the webinars are recorded. I mentioned at the beginning of the session that we're recording this webinar. They're available on both the CRWDP website and as well as the Conestoga College website. And I have the links provided on this slide here. So you can actually access the previous webinar that happened earlier this spring and this webinar, which will be posted hopefully within the next couple of weeks. And then the subsequent ones will be available there too if you aren't able to attend those in person. Last slide, please. Okay, I just want to thank everyone who is here today, Amin and Lena for your hosting, Pierre, Katie, Robert, Denise for the great panel session, and also to the audience for attending here today and being part of this session. Everybody have a lovely rest of the day and a great summer. Thank you all very much. Bye-bye.
Bye, everyone.
Bye, everybody.
Bye-bye.